Thank you and good afternoon. So for our update today, we have 34 new cases of COVID-19 in British Columbia, 3 of whom are epi-linked and the rest who tested positive. That brings our total to 3,362 people in British Columbia, including 1,049 people in the Vancouver Coastal Health Region, 1,742 people in the Fraser Health Region, 141 people in the Vancouver Island Health Region, 304 people now in the Interior Health Region, 69 people in the Northern Health Region, and 57 of whom are people who reside outside of Canada. We have 285 active cases today, of whom 17 people are in hospital, 3 of whom are in critical care or ICU. We have no new deaths to report today, leaving our total at 189 people. 2,888 people have now fully recovered. We continue to have 3 active outbreaks in our healthcare system, 1 in long-term care and 2 acute care outbreaks that are ongoing. And we've had an additional resident test positive, bringing our total number of cases in the healthcare system to 659 people, 403 residents, and 256 staff. We have no new community outbreaks. However, we now are following over 70 cases related to the community exposures in and around Kelowna over the last few weeks. As we all know, the BC COVID-19 curve is trending in a direction we do not want to go, and that is upwards. And we all need to take a step back and look at the things that we need to do to bend our curve back down where we need to keep it. We have proven that we know how to do this, and now each of us needs to do our piece to make that happen. Contact tracing 3 or 4 people is much easier and faster than trying to reach 20 or 30 people for every case that has come up. And that is the situation that we have found ourselves in the last few weeks. With each additional person, the time it takes us to find them, the potential for them to develop symptoms and pass it on to others is greater, putting more people at risk. As a direct result of the recent community exposures in Kelowna, there are now close to 1,000 British Columbians in every health authority who are self-isolating at home because they have been exposed to somebody who has been positive for this virus. This means these people are unable to work, to see friends, to leave their home, to enjoy the summer like the rest of us. So you can protect yourself and your friends and loved ones by protecting their household bubble, keeping those bubbles small, making sure you're not exposing lots of people. Spending time with those you know and using our layers of protection are what is going to help us control the clusters and the transmission we're seeing now and bend our curve back down. Let's stop the spread of COVID-19 with what we know works: safe physical distancing. We know that being outside is better than being inside, and it is good to see so many people enjoying our parks, our beaches. But if you are in a crowded location, being outside is not enough. We know that it can be transmitted when you're having close conversations, talking, laughing with large numbers of people, even if it is outside. So what does this mean? If you are going to the beach or a lake, choose a quieter spot. Keep away from others. Keep that distance between your group and other small groups. If you're planning to see friends, include only those in your bubble. Recognize that every time you burst your bubble, you are bringing others in and your risk increases. If you're going out for dinner, don't ask the servers to accommodate more than 6 people. No table hopping. 6 people is what is restricted under our WorkSafe guidance and our public health orders. So no trying to work around it by sitting separately and moving between tables and gatherings. That just puts others at risk. The COVID-19 safety plans are in place for a reason, and these are the plans that businesses have adhered to make sure that both staff and customers are safe. And these are the plans that we will be monitoring both with WorkSafe and public health inspectors to make sure that we are supporting restaurants and pubs and businesses across the province to keep everyone safe. We also need to remember to wash our hands regularly, cleaning more often, following those one-way paths in the stores. That is important. It is a way of helping us protect ourselves, but protect others too. Using our barriers and wearing a mask when distance is difficult are things that we need to do. That is our hierarchy of controls, where we have our distancing between us is what keeps us safe, and also making sure that we're having smaller numbers, washing our hands, following those signs that keep us apart. When traveling, be considerate of the communities you are visiting and use your travel manners at all time. And we can model this for those who are coming into our communities from outside the province or from around the province. Avoid contact with people in smaller communities. Get takeout instead of eating in. Put a mask on if you are popping into the local grocery store for extra supplies. And of course, considerate travel includes always, without exception, delaying your trip and staying away if you're feeling unwell. Over the past few weeks, we've recognized that risks within bars and nightclubs and recent links to exposures in these locations have occurred. And as we've discussed, we are now amending the provincial health order to put in place more restrictions, more things that will help us control those environments and make them safer. All patrons must now be seated at a designated seat. There's no liquor self-service or dance floors, and measures need to be in place to reduce lineups and gatherings and pressure points. Changes in the requirements for events, as we call them, have also been made to further reduce the potential of transmission in these higher risk environments. The details of this amended order will be posted online shortly. And I want to say thank you to the industry reps, the people who worked at the BC CDC, with WorkSafe BC, with my office and others, to make the changes, to find practical ways that we can assist industries in keeping the bars and pubs and all of the things that we are enjoying open but safe, and safe for all of us. And we need to do our part by not trying to bend those rules. Let's focus our efforts, be mindful of those around us, and give each other the space to stay safe. We can all have fun and a safe summer despite COVID-19. We are not going to go back to things we had to do earlier this year, but in order to keep going forward, we need to go back to safe social interactions. We need to play safe and stay safe.